To get things started this morning, I'm pleased to hand it over to CDPHE's Executive Director, Jill Hunsaker-Ryan. Good morning, Director Ryan.
Thank you, Brian. Hello, everybody. Thank you so much for joining us today. You know, tomorrow, March 5th, marks 2 years since the novel and deadly coronavirus was detected in our state. And I want to take a minute to introduce our team members on this call as we take a look back and also prepare for our future. We have Dr. Eric France, who's our Chief Medical Officer at the Department of Public Health and Environment, Scott Bookman, our COVID-19 Incident Commander, and Dr. Emily Travanti, who is our State Laboratory Director. You know, in looking back, looking ahead, I just want to start by acknowledging how far Colorado has come. This virus is so novel, and we've never seen anything like this in our lifetime. The fact that it's highly contagious, that so much of it is spread asymptomatically, and then its clinical expression varies from little or no symptoms to severe illness and even death in some people. And I think it's really hard for individuals to gauge their own risk level. The last couple of years have been historic, and we have faced the pandemic the Colorado way together, really from the combined response of state and local governments and the partnerships with the business community to the perseverance of parents and teachers, and the determination of individuals and communities to stay healthy and live their lives. As Coloradans, we know what it's like to scale mountains, and really, that's what we've done. You know, the complexities of this virus, including its nature to evolve, have made containment challenging. But our state response has been dynamic. We've had so many successes and are fully prepared for whatever the future holds with the virus. The state of Colorado's response has always been data-driven, which has allowed us to stay one step ahead of the virus. And I will show you some of our metrics today to illustrate where we are. And we've always carefully weighed our disease suppression strategies with their potential economic, social, and educational impacts that can have negative consequences to health and well-being. As a state, our guiding North Star has always been to protect the hospital system so that anyone needing a bed for COVID-19 or emergency surgery, trauma, or childbirth will have a bed. And we have been successful at this. Looking at this slide, since the beginning of the pandemic, Colorado's cumulative death rate has been lower than the US average. Of course, it's with heavy heart that we acknowledge and honor the 12,556 people who have died in Colorado due to COVID over the last 2 years. At the same time, Colorado has the 10th lowest COVID-19 death rate in the nation, and that can be largely attributed to our nimble response and the sacrifices of Coloradans statewide. This next slide shows where we are today in terms of the case count. Case counts have decreased to levels not seen since last summer. Omicron is so much more contagious than the Alpha and Delta variants, and luckily with milder illness in most individuals. So the most recent wave was high and short, and it left a layer of immunity behind. Now, we don't know how long immunity from the virus will last, especially in those who are unvaccinated, and it varies by individual. But between this and Colorado's relatively high vaccination rate, we know we should have much better protection heading into the warmer months and the end of the school year. Next slide. And the state's testing positivity level had a high peak and is now below our 5% goal at 3.6%. Next slide. Current hospitalizations from COVID-19 have decreased significantly since the Omicron peak and are back to last summer's levels. I think you can see from these slides why the governor says, if you are vaccinated and boosted, go live your lives. Now, we will need to continue to monitor variants of concern, and we are prepared if a more contagious variant outcompetes Omicron or is better at evading our immune systems. We also don't know the level to which immunity will wane by next winter, and if you will see a significant winter wave. But these are our scenarios that we are planning for and will be ready for. Next slide. And finally, I wanted to show you this slide. The School of Public Health has been providing modeling data to us throughout the pandemic. And due to the asymptomatic nature of COVID, they have attempted to estimate our true epidemic curves, including the infections with no or mild symptoms that are not detected through testing. On this slide, the light purple indicates the total number of infections per day modeled by the school, and the dark purple line is infections detected through testing. And I think this really serves to illustrate the contagiousness of the Omicron wave and the true magnitude of what we have faced really throughout the pandemic, making where we are today even more special. I will now hand off the presentation to Dr. Eric France to talk about the ways Colorado has protected itself throughout the pandemic and some key milestones. Dr. France?
Thank you, Director Ryan. It's hard to believe it's been 2 years that we've been living through this as a state. As Director Ryan has shared, we have spent 2 years battling this unpredictable virus, and now we plan to prepare for a future in which COVID-19 remains a part of our lives. These past 2 years have brought us an unprecedented public health emergency, and we built and scaled our public health response in a way we had never seen before in order to meet the moment. We were able to expand our testing across the state. If you remember, we could only do 160 tests a day in March of 2020 and quickly scaled up over 300-fold to do 50,000 tests per day. Coloradans have received more than 2.5 million free at-home testing kits through the mail and at community pickup locations to protect themselves and their families by being able to test at home when they felt ill or before attending holiday gatherings. We're grateful to have life-saving COVID-19 vaccines available to us. And over the last 14 months, nearly 4 million Coloradans have completed the primary series of a COVID vaccine. And Colorado is 11th in the country for people getting their third or booster dose to stay up to date with this protection. We know that COVID-19 is going to be with us for the foreseeable future, and all of our experiences over the last 2 years have prepared us for where we are now, a time made more optimistic by the availability of vaccines and therapeutics. As Coloradans return to more normal lives during this time of low disease transmission, we will continue to monitor COVID-19 in the state and remain ready to surge our public health response if the situation changes. One of the ways that we are going to follow COVID-19 in Colorado is by the work of our state lab. Our state lab director, Dr. Emily Travanti, has led this team from the start of the pandemic, and their work monitoring COVID-19 helped Colorado become the first state in the country to identify the Alpha variant through genome sequencing, and the third in the nation to identify the Omicron variant. Dr. Travanti and her team at the state lab will continue to play a critical role in tracking COVID-19 and any potential new variants in the state. I'd like to hand it over to Dr. Travanti to talk more about that work.
Thank you, Dr. France. We have learned so much about COVID-19 over the last 2 years, and this knowledge has informed our efforts and helped us to create and maintain a robust statewide COVID-19 surveillance network. Our past efforts provide us with important infrastructure that allows us to keep an eye on COVID-19 in Colorado while people look forward to enjoying summer and spring activities. Our state laboratory has been running 24/7 since the beginning of this pandemic, analyzing tests and sequencing more than 108,000 positive results to ensure that we have the best information available about how and where COVID-19 is circulating, while tracking variants of concern here in Colorado. As Dr. France mentioned, the efforts at our state laboratory have kept us at the forefront of the nation for early identification of variants in our state. Next slide, please. Colorado has been among the leaders nationally in wastewater surveillance. Wastewater surveillance is important because we can identify the presence of a virus in a community before we have results from clinical testing. Using this method, we were able to estimate trends of disease within a community because it can capture data on individuals who are asymptomatic or who may not seek testing, It also allows us to sequence wastewater samples to monitor for the presence of COVID-19 variants of concern in specific communities. We originally started the wastewater surveillance program with 21 participating utilities, and we are excited that this program has nearly doubled in size to 41 utilities that collectively serve 55% of Colorado's population today. This encouraging increase in participation gives us a broader ability to look at early warning signs of increasing community transmission in areas across the state. Wastewater surveillance is a powerful tool for ongoing monitoring of not only the level of COVID-19 in a community, but also as this early warning for changes in the virus, allowing us to continue to watch for signs of new variants without requiring asymptomatic people to seek treatment and testing. The combination of sequence surveillance from both the clinical and the wastewater samples will provide an ongoing understanding of how COVID-19 is impacting our communities. I'm so proud of the work that our teams have done over the last 2 years, and we remain committed to tracking COVID-19 in the state to help inform the public in the coming months. Director Scott Bookman is here now to talk a bit more about the COVID roadmap forward.
Thank you, Dr. Travanti. Thank you all for joining us here today. As Executive Director Ryan indicated, we are at another turning point in our response to COVID. It has been 2 very long years, but Coloradans have come together to allow us to move forward. And we're at a point now where disease rates are low and getting lower by the day. We have high immunity from vaccination. And so we are at a point where we can begin to look forward to the next step. And so last week, we rolled out our roadmap to move forward. And while members of the public who are up to date on their vaccine and aren't vulnerable will have the ability to move forward with their lives, we want the public to understand that behind the scenes, our teams will continue to move forward, preparing for whatever may come from COVID or any other communicable disease or disaster in the future. So there are 4 key pillars to our roadmap: hospital readiness, public health preparedness, healthcare workforce expansion, and engaging in federal government reform. Our hospitals have been incredible partners over the course of this pandemic, and they have scaled to meet the needs of the moment. We have also seen great partnership from our long-term care facilities, behavioral health institutions, and pharmacies and primary care. We are at a point now where we have a lot of tools available to us, particularly these new therapeutics. And it is critical that we start normalizing COVID into the traditional healthcare system so that people who test positive for COVID are immediately connected with the therapeutics that can reduce their risk of hospitalization by up to 90%. We need to make sure that our hospitals have a predictable, reliable amount of surge capacity so that we can always scale to meet the demands of whatever future waves of COVID or any other illness may require from us. And we need to ensure that the entire healthcare continuum is staffed and can meet the needs of the moment. So that includes looking at staffing in our long-term care facilities and looking at our behavioral health capacity as well. I'm going to go a bit in a moment into more depth on pillar number 2, but I'll skip to pillar number 3 right now. Our frontline healthcare workers have been the absolute heroes on the front lines here over the last 2 years. But this pandemic has taken an enormous toll on them. We are seeing people leave the profession at high rates. And so we need to partner with our institutions of higher education, with our healthcare providers to ensure that we are creating a pipeline and getting people into helping healthcare professions to ensure that we have the ability to take care of those who have COVID or any other illness into the future. Then obviously we can't do this alone. COVID is a national and an international problem. And so we need to work with our federal government to ensure that all the reform efforts that are needed occur. We need uniform guidance on surveillance in our most at-risk populations. We need to look at areas where we have seen potential price gouging in staffing contracts. We need to look into the future of long COVID and make sure that at a national level, investment is made in research and treatment for long COVID. And then obviously, public health readiness and surge capacity. On the next slide, I want the public to understand that behind the scenes, your public health system at the state level and with all of our local partners, we will continue to prepare for whatever the future may hold with COVID. We will make sure that we are updating all of our disease investigation and surveillance systems so that they are ready to determine if there's an increase in any type of COVID cases out there. As Dr. Travanti discussed, we will be looking into continuing to expand that wastewater surveillance or whole genome sequencing to make sure that we have the most up-to-date information on what this virus is doing and where it is headed. We'll continue our outbreak prevention and response activities in our most high-risk settings where people live in congregate settings together. And then obviously we continue our vaccination and other efforts in our most vulnerable communities. And so we will continue our mobile efforts in bringing buses to locations where we can meet people where they are to get the vaccines that they need. We'll also look into what is the impact of indoor air quality in our schools and in other public settings where we can continue to provide ongoing protection for the public. And so this is the work that we will be doing behind the scenes to monitor where COVID is and where it may be headed. On the next slide, we will maintain capacity to scale to meet the demand of the moment if it is required. And so we will be able to scale up our mass testing sites again, our mass vaccination efforts, our distribution of therapeutics, and then working with our emergency management system and our emergency management partners to make sure that we have a stable stockpile that we need of critical equipment to protect Coloradans as soon as it becomes necessary. So as we move forward, as the disease rates allow us to do so, we will continue to do all of this work behind the scenes